All right, part 2 of this learning plan. Who makes the decision? You know, it says 13%, on average, only 13% of patients have advanced directives. Half of all cases, the patient will be unable to participate in decision making, and in those cases, family members have to decide. So who makes that decision? If your grandparent, if your parent, if your husband or wife, or if your child is in the hospital, who's going to make that decision? Planning ahead with advanced directives helps eliminate ethical dilemmas because you now know kind of what the person wants. Few of us will actually end up ever making end-of-life decisions for a loved one, and that's really good. But some already may have. Somebody in this room may have made that decision. It can be, not can be. It is a very tough thing to do. But if you don't know what the person wants, if the person's never talked to you, if the person doesn't have their information on paper, their wishes on paper, how do you know what to do? And that can make decisions that are not so good. So at the federal level, there's this Patient Self-Determination Act, and that's why that everybody is asked if they have advanced directives when they go into a hospital. If they will give you written materials. When I went in for my surgery, I had my papers in hand. And I said, "Here's my advanced directives." They're like, "Cool." So at a federal level, they're really pushing so that everyone knows what people want done. It prevents problems. Now, there are different types of advanced directives. There are durable power of attorney for healthcare, and then there's a living will or directive to physician, and medical directives. So what's the difference between those two? Durable power of attorney for healthcare. If that's put in place, that person is authorized to make all of your decisions regarding healthcare. They are not necessarily limited to what you want. They can go on their own and decide something else. So you want to be very careful in choosing who will be your power of attorney. But commonly, when you have durable power of attorney for healthcare, you also have a living will, which makes the statements of, I want this, this, and this, I don't want that. Presumably, you will have discussed this with your power of attorney and other people so that everyone knows what you want. It's all about the communication. Any competent adult can complete an advanced directives. You do not have to have a lawyer. In fact, you can go to this the Wisconsin website. I'll give you the website, and you can download the paperwork and do it on your own. It's very simple. You can change your mind at any time. Throw it away, tear it up, it's all done. It's hard to cover all scenarios. It has very limited options on what it addresses. And it does require witnesses, and every state has different requirements for the witnesses. In Wisconsin, it has to be 2 people that are not going to benefit from this, that are not providing care for you. When I went for the surgery, I had a couple of the other teachers here on staff here sign witness for me. So, and it's a formality. So, developing and documenting advanced directives, the legal guidelines they don't just cover life-sustaining or serious treatment decisions, but all health decision making. From whether or not to use Accutane for acne or penicillin for strep throat. Or whether to have a bone marrow transplant. When you have power of attorney set up, they make all the decisions, not just CPR or no CPR, but everything. So there needs to be discussion between the healthcare provider and the patient about treatments. There needs to be open discussion among everybody so that everybody understands the ramifications of decisions, complications, potential benefits. It's a hard thing to talk about. Now, in the discussion phase, when you're talking about what you want, when you're getting information, when you are discussing with your family members, that's a process. Okay, that's a process. When you fill out the actual document and you have your advance directive taken with you to the hospital, that's a structure. Remember, if you can hold it, it's a structure. If you're talking about it or doing something about it, it's a process. The outcome in this situation would be that there's a person designated to make those decisions if need be. So this product, this piece of paper that is signed and witnessed, is what people will use to make the decisions that you would have made if you were able to make them. Advance directives and power of attorney are only put into place when a person can no longer participate in their own cares. So what therapies can be withheld and withdrawn? Pretty much anything. You can remove a ventilator. You can stop blood transfusions and stop dialysis, stop antibiotics. Some states specifically say that food and hydration are also allowable to withdraw. Other states don't allow that. There's some controversy on that. Nursing home placement can be withdrawn and withheld or initiated. Two conditions must be met. There must be a threshold condition. So the patient must have lost the decision-making capability and in a condition that's not reversible. And so that's basically it. They have to be in a condition where they can no longer participate in their plan of care, they can no longer communicate their decisions, and they have to be in a situation where it's non-reversible. So when I went into the hospital, let's say during the post-op anesthesia area, something went wrong. Can my wife be my durable power of attorney? No, that's not an irreversible chronic threshold condition. If my heart stops and I'm brain dead, now she can make those decisions. And that's the end of part 2. Come back for part 3.